I'm Dr. Stephen Fenton, cardiologist with Bligh Street Cardiology. I'd like to talk to you for a couple of moments about heart attack prevention. You know, heart disease, and particularly heart attacks, are the leading cause of death. After World War II, there was an epidemic of heart attacks, and it wasn't until 1962 that the first practical step occurred when coronary care units were developed, and the first one was actually in Sydney. Coronary care units allowed close monitoring of heart attack victims, and that allowed management of some of the serious complications with things like defibrillators and pacemakers. It wasn't though till about 20 years later, in the 1980s, it was realised that heart attack was caused by acute thrombosis or blood clots in a coronary artery as a result of plaque rupture. And after that, new treatments developed, including clot-dissolving treatment and subsequently balloon management called angioplasty and now stenting. And they have allowed a huge reduction in mortality from the original 50% before coronary care units, and then 30% with those, and subsequently now that we can open up coronary arteries to just 5 or 10%. So if you can get to a hospital, if you're having a heart attack, your chances of survival are about 90%, which is outstanding. However, many people don't get to hospital. About 50% of people die before they get to hospital. And that's why the heart attack statistics are so bad. And tragically, many of these people are in their prime of life, both at work and being productive, and also clearly a great loss to their families. So at Bligh Street Cardiology, we feel that heart attack prevention and early detection is really important, and that's one of our very strong interests. At Bligh Street Cardiology, our emphasis is on heart attack prevention by early detection and effective management, and we like to think that we specialise in that area. The test that we like to do on people to pick that up is called a calcium score, and it's a simple X-ray test, a bit like a mammogram of the heart, and it's quite simple to do, but interpreting it and managing it effectively requires a great deal of expertise, which is our strong interest here. So if you have risk factors and your doctor thinks you could be at risk of a heart attack, it would be a really good idea to think about coming along for a heart check to sort yourself out. And the risk factors I'm talking about include some of the obvious ones like smoking, high blood pressure, high cholesterol, bad diet, not exercising, too much stress. But there's quite a few others that also we know now can be risk factors, such as obstructive sleep apnea, which is quite common, depression, and actually long distance endurance athletes can also be at risk. So if your doctor thinks you're at risk, it would be an excellent idea to have a chat to your GP, and if he thinks you're at risk and need some of this testing and management, we'd be very happy to see you.